We take you to these shooting scenes and we've heard from police. What about the other group of people who see this type of violence every day?
Joy Wang is here in the studio now. Joy, you were talking to these healthcare workers who treat these trauma patients.
Yeah, that's right. So UNM Hospital is the state's only level 1 trauma center. And I sat down with the head of the emergency department, Dr. Steve McLaughlin.
For us in the emergency department, it's something that impacts us every day because we are seeing these patients every day, and we see the impacts that it has on the patients, on their families, and for the people that survive, how it impacts their lives as they continue forward.
You're looking at video from the latest homicide investigation in Albuquerque, and here at KOB, of course, we report on each one. But what about all the other injured victims? Dr. McLaughlin says right now the two biggest health issues are the COVID-19 pandemic and the gun violence across the country. That's right, he is calling gun violence a public health issue. For more than 2 decades, he's worked at UNM Hospital and says the gun violence he's seen at the emergency department has gone up dramatically.
I would say it was a once a week event where we would have someone that would be brought in with a gunshot wound, and now it's almost every day that we're seeing at least one person come in, and sometimes it's multiple patients at one time. So it's become an almost everyday activity.
You might think, okay, we're not hearing of homicides every day, and you'd be right, except at the state's only level 1 trauma center, they're dealing with all types of cases involving gun violence, injuries because of guns, not just deaths.
The statistics would indicate that for every person that's actually killed by a firearm, there are 2 or 3 additional people that are injured but survive. So those are the patients that we see in the emergency department as well and take care of. So what you see on the news is just the tip of the iceberg in terms of the people that are actually being injured by gun violence.
This pandemic has been incredibly tough on our healthcare workers already. We are going through 20 months of this pandemic. And so in our next hour, we're going to talk about how crime is impacting them on the front lines. We are still in a pandemic. Well, Dr. Steve McLaughlin, the head of UNM Hospital's emergency department, says COVID-19 and gun violence are actually the 2 biggest public health issues going on right now.
The reason why gun violence has become something I'm really concerned about over the past couple of years has been, number 1, that it's becoming more common. Number 2, having seen the toll it takes on the patients if they survive or their families. And the third one is that I think we have an opportunity to do better at preventing it.
Just yesterday, we reported on Albuquerque's 99th homicide investigation, but for the state's only level 1 trauma center, they're looking at all the other cases of gun violence that don't always make it onto the news. We're talking injuries almost on a daily basis, people who survive gunshot wounds but never really get their life back.
Impact of that for the patients that survive is also huge. Some of these patients have spinal cord injuries. They may be paralyzed. They may have abdominal injuries that result in permanent changes in their physiology, and they may need, multiple surgeries, and the recovery can be really long.
And it's not just the person injured who's a victim. Family members also having to take on that extra responsibility, both physically and emotionally.
The psychological trauma of having this happen is really tough on people. So there's the impact that it really changes a person's life even after they survive.
Then there's the trauma our healthcare workers are also dealing with. Again, all of this is happening during a global pandemic. Healthcare workers not just dealing with a lot more death because of COVID-19, but also increasing gun violence across the country.
What we're seeing across the country is that a lot of people are choosing to exit the career, and so that's been a real challenge. And the folks that are staying in healthcare, we're spending a lot of time really trying to support people, really focused on mental health, trying to reduce the stigma of healthcare providers asking for help if they need it. And there's obviously high levels of depression and PTSD in healthcare workers during this time as well.